humans, how's it going? Susan Ruth here. Thanks for listening to another episode of Hey Human Podcast. This is episode 246. It is with Josie Alston. She is practically a sister to me. She is the sister of my best friend Ellen, whom you have heard me speak of a million times on this show. Josie is a badass. I love her dearly. She's the clinical director of the Voice and Swallowing Clinic and chief of the Division of Speech-Language Pathology in the Department of Otolaryngology and Head and Neck Surgery at the University of Mississippi Medical Center. She's also the mother of an extra special child who has autism and something called global apraxia. Not a lot is talked about apraxia. I think it's getting more talked about, but it's really good to have Jo on the show talking about this. I'm really glad that she was able to take some time out. She also has gotten the first round of the vaccine, so that's exciting. She talks about that a little bit as well. The vaccine for COVID, So I'm excited for you to hear this episode. It's like having family on the show, and so that makes, for me at least, it extra special. I want to talk about a show that I recently watched that Ellen insisted I watch, and it was excellente. It's on Netflix. It's called Surviving Death, and I loved it. I was fascinated by it, and I want to get a couple of the people that are on that show on this podcast. I especially enjoyed the last 2 episodes. I think there's only 6 episodes. The last 2 deal with reincarnation, which I am fascinated by, and it's a must-watch. It's so good. And I have thoughts about the mediums that were on there. There's one of the mediums has all this pomp and circumstance around her. You know, music has to be playing and she has to be in this dark room and all this stuff. And she, to me, seemed far less believable than this other woman who, she has really long blonde hair. She just comes in, sits down, and talks to people, and information comes out. There's no other stuff, no music, nobody has to dance or chant or hold hands or anything like that. And she was really believable. Anyway, that's just my take on it. I highly recommend the show. It was really interesting. If you have any interest in what happens when you die, or is there reincarnation, or do people have visions of angels, all that kind of stuff, that's all in there. And I really thought it was cool. That's my big recommendation. I'm trying to think if I've watched anything else this week. I feel like it's been such a busy week that I haven't really gotten a chance to dig into anything. Oh, I also started the Fran Lebowitz Pretend It's a City, and that's a real kick in the pants. She's a character for sure. I've been enjoying, I've only gotten through the first episode, but I did enjoy it. I liked it a lot. Okay, let's get to the other stuff. Hey Human is on social media under Hey Human Podcast, Facebook and Instagram. Susan Ruthism, if you want to just find my stuff, SusanRuthism, and that is on Facebook, Twitter, and Instagram. You can email me, susan@heyhumanpodcast.com. If you go to heyhumanpodcast.com, you're going to find all sorts of fun things, including a links page. Every episode gets a bunch of links to whatever we were talking about, articles, books, references. I try to compile that all up for you so that it's an easy one-stop. You just go to the website and you can get all that information. Find out my guest social media, their websites, things like that. Also on heyhumanpodcast.com is a store where you can get Hey Human merch. And please do that, because that's real cool. I designed a bunch of things for you, and you can check that out. T-shirts and hats and artwork. There's a couple tote bags that have some of my paintings on them, and I thought they turned out pretty cool, if you ask me, which you didn't, but I'm going to tell you that anyway. Rate and review Hey Human on iTunes or wherever you get your podcasts. It really helps a lot. Please, if you have 5 minutes, it probably doesn't even take that long, go rate and review the show. If you like music, you can find my music on iTunes under Susan Ruth. Pretty easy to find that. And I think that's about it. Oh, if you go to susanruth.com, you can learn more things about me that are different than the podcast and sign up on the mailing list. And I send out a mailer about every quarter. So definitely do that if you are into that kind of thing. Okay, let's get into this. Thank you for listening. I appreciate it. Stay safe, be well, get the vaccine, be happy, be kind, and here we go. Josie Alston, welcome to Hey Human.
Thank you, Susan, and hello to all you humans out there.
Where are you from?
So I was born and raised in Nashville, Tennessee, and lived there for many years. Went off to college at the University of Georgia, back to Tennessee, where I did graduate school. Oops, I better turn that down. And then back to Nashville, where I worked for the first part of my career. And then currently, right now, I live in Jackson, Mississippi.
All right, let's go back, though, to you're in college. Did you explain what your title is so that people have a touchstone?
I mean, where I work right now?
Yeah.
Okay. So right now I'm the chief over the Division of Speech-Language Pathology at the University of Mississippi Medical Center. And basically that just means that I manage a lot of speech pathologists. There's about 30 of us, 20 that are full-time, 10 that are part-time. And we work at 5 different campuses here in Jackson and surrounding areas. There are about 14 different specialties within the speech pathologists. And so really, I'm just kind of the leader of our division of our specialty here at the medical center.
Sounds like a big job.
It is a big job, but one of the things I love about it is that I also get to continue to be clinical at the same time. I'm still seeing patients 2.5 days a week, in addition to all of the administration and managerial stuff that I have to do. So I feel like I'm still in the trenches most of the time. I still get to have those wonderful moments where I'm helping patients and learning and educating and doing research. So it definitely put a lot more on my plate when I took that leadership role. But I was, after 20 something years, you're ready for new challenges, and learning how to manage people is, especially a lot of women, it's definitely part of that. So I've enjoyed it.
Is it a more female oriented field?
Yes. So our field, and that's one thing that they're trying to change nationally, but we are probably 99% female.
Wow.
It's crazy. I know. So when you're an undergrad in this field, you are learning about speech and language, but you're also learning about hearing, because those two processes are so interconnected. And then when you go to grad school, you sort of have to make a choice between the two. Now, you can get duly certified as an audiologist, where you learn more about hearing, or as a speech language pathologist, or you can do both. And back in the day, there were a lot of people that did both. But now, because to be a certified speech language pathologist or a certified audiologist, you have to go to graduate school. And the AUD, which is for audiologists, they actually go a little bit longer than our 2 years, and they get a doctorate degree. So they have a doctor of audiology. Speech pathology is just a master's. So you make that choice. It's hard. And I loved both. Like, I loved my sign language class. And I have some really funny stories about doing hearing tests on people, but in the end, I really felt drawn to speech just because I love talking. So, and most speech pathologists do.
Let's go back to college. Actually, I want to go back further than that. When you were a kid, did people who maybe had trouble hearing and or speaking, was that something that piqued your interest early on, or was it something later as you're in college and you thought, this is what I want to do?
So I don't remember anything, any person growing up that ever went to speech therapy. Like, I never even heard of it. And I've thought about this so many times. It's weird that you asked me that question, because when I was in college, you think, oh, I have to choose a major and then I'm going to do that for the rest of my life, right? That's what you think at 18. And so after about 1.5 years of college, I was sitting in my economics class thinking, oh my God, I hate this. How am I going to do this for the rest of my life? It felt like I was just going to be miserable because I just didn't connect with it. So I did a career placement test. And so it made me one of the things that this career placement test did was throw out different service industries. So like social work, physical therapy, nursing, speech pathology, even medicine. Like if I wanted to go to medical school, those were a lot of the things that it said would make me feel fulfilled. But I'd never even heard of a speech pathologist. I didn't even know what they did, or didn't know anyone that had ever been to one. And maybe that was because I went to Catholic school my whole life, and we didn't have specialists. And even to this day, a lot of the Catholic schools don't have special education teachers as a regular part of their teachers or curriculum in there. So I really wasn't exposed to it, but I thought, I know some people that are majoring that. I'll ask them about it. And they said they liked it. So I was, like, okay, whatever. When you're in college, you're just like, is it easy? Can I get an A? So that's how I did it. But, after like kind of jumping ahead, I've always kind of wondered why I chose that field. And I really feel like it was almost a God wink because, as you know, I know your listeners don't know, but my oldest son has been diagnosed with autism and several other things, apraxia, sensory integration disorder. And so I don't know, sometimes I feel like God helped me get to where I am so that I could understand what's going on with him, so that I could advocate for him, so that I could not be completely overwhelmed by all the different steps that we've had to go through to get him services and things like that. So, thinking back on it, I feel like maybe there was a higher power that was leading me down that road. And I love thinking of it like that just because I'm a spiritual person. But, it was definitely a good fit for me. I love what I do. And since the day I made that decision, it's just taken me down a whole different journey.
Your first job out of college was in Nashville at the Voice Center. Is that correct?
Correct. Yes. So I am a voice and resonance specialist, I guess you would say, within the field of speech-language pathology. Most people, when they hear of a speech therapist, they think of like stuttering, like, oh, you help people talk again, or, oh, my grandfather had a stroke and he went to speech therapy. So those are the two things they usually think about. But I am actually a voice and airway specialist. So I worked at the Vanderbilt Voice Center for several years, where you get to learn how to help people rehabilitate diagnose and rehabilitate different voice problems. So if they're having hoarseness in their voice, maybe they have cancer, throat cancer, maybe they have stenosis of their airway and they can't breathe very good. Yep. Mm-hmm. Okay. So like sometimes after you've been intubated. So like right now with all the COVID patients that are getting intubated, we're seeing a rise in the number of patients that come in, and 6 to 8 weeks down the road, they have trouble breathing and they've developed scar tissue in their trachea. And so you have to scope them and see their airway at the top of the trachea, and then they have to have surgery to help that. So what I do is very medical, I guess, compared to what some speech pathologists do when they do like articulation therapy or language therapy. So that's the great thing about my field, is there's so many different specialties you can go to within this field.
I know that in Nashville, of course, there's so many singers, and that was a lot of them would come in and get shots so that they could sing when they had no voice. And I myself, in my career as a singer, have had those shots where I had a big show and I had to perform, which is terrible, of course, but and had to get the shot.
Right. I mean, your voice is your instrument. It's your moneymaker. And when the really new artists have, when they get signed, they have to go from doing, I don't know, maybe like 40 shows a year to doing like 200 shows a year.
Yeah, it's nuts.
And they don't, singers don't always have the best habits, which affects their voice. So there's a lot of education that goes on. I remember working with several singers who just got their label. They're really excited. And then I look at them and I'm like, okay, now do you smoke? And they're like, well, I'm like, you can't do that. That's really bad for your vocal cords. Do you drink alcohol?
Yeah.
And they're like, only in between sets. And I'm like, okay, that's even worse. You can't do that. So there's a lot of education you do with singers. But yeah, that was a really interesting and fun time for me starting out in my career. Because you'd walk by the exam room and you never knew who was sitting in the chair. I mean, it could be one of the most famous singers in the world, and they're sitting right there, and you have to go in and talk to them and act like you're just sitting in front of Joe Schmo. And, it was definitely a fun experience.
Adele, I believe, famously had some issues with that between her first and when she launched so largely that, and I guess she was a real breath. She didn't use her breath a great way, and so it caused a lot of problems for her.
Yeah, because you have to remember, singing is like it's almost like the Olympics of voice, because everything has to be perfect. Like, you have to have good breath support, you have to have relaxed musculature. So, a lot of singers won't ever even touch their neck. And I'm like, you've got to massage these muscles, just like, if you were a runner, you're going to go out and stretch and massage those muscles maybe for an hour before you go and run a 10-second hurdle race. But a lot of singers, they have to learn how to really treat every aspect of voicing, whether it be what you're eating, what you're drinking, how much of it you're drinking, like water. They have to learn how to use good breath support. They have to learn how to massage muscles. And there's definitely training that goes into it.
Yeah. Can we talk about apraxia a bit? Sure. This is what's so wild about my childhood best friend. Her son was diagnosed with apraxia. I think he was around 3 when they made that diagnosis. I had never heard of it before. And then your son also. And of course, you're the sister of my bestest friendest. So you are like a sister to me as well. And it's wild to me that I'd never heard of this thing, and then suddenly 2 people so close in my orbit are, learning about it and understanding it. Can we talk about what it is? Because it's a fascinating issue.
It is. It is fascinating, and it's pretty rare in the world of speech and language disorders. I mean, apraxia isn't one of the more common things that we see. And what's really hard about diagnosing apraxia is that they can have it from a very young age, but you're not born just coming out speaking and making perfect sounds and words. And so it's really hard to tell in the beginning, is it a disorder or is it a natural part of learning language? And sometimes you won't even get your apraxia diagnosis until you're 7 or 8 years old. But basically what it is it's a programming function of the brain that's off. So we have motor pathways that the brain uses to teach you how to form your lips or your tongue when you're learning to speak. And even though you might not get it perfectly correct in the beginning, like, right. Like if you say wah instead of water, eventually your parents will show you with their mouth, like this is how you say it correctly. And through practicing, you get closer and closer to that approximation, and you do it correctly after a few times. But a child with apraxia of speech might have to practice it something that would take 10 times with a normally developing child might take someone with apraxia 10,000 times before they start to get it correct. They have to form a different pathway in their brain, getting to their articulators, telling them how to function. So it's hard. I think the hardest part is just getting the diagnosis with apraxia. Once you've kind of gotten there, then you can start treating it correctly. But the hardest part is, and Will doesn't just have apraxia of speech. He also has something called global apraxia, which means that he has it in his limbs as well, like his fine motor, his fingers. It's really hard for him to hold a pen and his brain to tell his fingers how to make the movements to write fluidly. So like he'll probably be a better typer than he ever will a writer. I mean, he's 14 years old right now, and he still writes as if he's 5, maybe. But of course, he's been in therapy in special schools since he was 2.5. And that's, the level that we're at right now. Some people will advance through their apraxia and you won't notice, once they're in high school that they're that different. Others, it's a slower go of it. Will couldn't ride a bike, for example. The motion of making the legs work opposite of each other. One leg is up, the other leg is down when you're riding a bike. He couldn't do that. So things crossing the plane in front of him, he couldn't do that either. But he can do all that now. So it just took time.
As a parent who happens to have specialized skills in these areas, how did you handle the frustration that he had? Because, on one hand, you're mom, but also how to help someone eventually get through these blocks, if it's possible to get through them.
Yeah. So being a parent of a special ed child going through the numerous evaluations and doctor's appointments and IEP meetings, there's a grief and there's a sadness because along your journey, you realize your child is going to struggle. I mean, you see them struggling in front of you. And even though I understood probably more than the average parent about speech and language, it still wasn't my specialty. I mean, apraxia was not my specialty. I had to learn about it. I had access to a lot more information about it, I think. But I remember sitting in my first IEP meeting with him when he was 3 years old, trying to get him into services through the preschool program. And I remember having this just overwhelming sadness that I'm sitting in this meeting and I knew more about his problem than the education specialist sitting in front of me in the meeting. And that if I didn't know what I knew, he wouldn't be getting everything that he needed because I was his advocate. And you think the schools are supposed to be the advocate and the specialists are going to be the advocate, but it's not. It's the parents. And so you have to become an education specialist. You have to become an insurance specialist. You have to, I had my insurance tell me, he also has autism. They told me that that was not a medical diagnosis at one point when they were denying therapy. So you have to become a legal specialist. You have to know your rights and you have to know how to fight for them. And then you have to try and do all of this at the same time that you're thinking, my child can't communicate. They're so frustrated, and I don't know what they want, and I don't know what they're saying, and I don't know if they're hurting, and I don't know if they feel bad. And then, you have the typical parent worries of, is he going to stick out at the birthday party? Or, is he going to make friends at school? Did he like the lunch I gave him? I mean, I know one example where at an IEP meeting, the teacher said, "Oh, by the way, all those snacks you're sending, he doesn't like that. He tries to throw them away every day." Well, we're 5 months into the school year and you're just telling me this right now? Like, he couldn't tell me that, because he struggled. And so things like that, you get really mad and you get really sad. And I feel like I would cry all the time at the IEP meetings because I was so frustrated that I was having to fight so hard. It's like, and I know every parent of a child with special needs feels this way. I know they do. I've had these conversations with them. You feel like you just have to fight for every little thing. And why has our education system not figured this out yet after this many years? How have we not figured out how to help these children and whatever their disability is, whether it's developmental, whether it's acquired, a traumatic brain injury, genetic, whatever the problem is, why have we not figured out how to help them? And why do the parents have to fight and get legal advocates involved, to get them what they need? So there's a grief. I mean, there's even things today. Sorry, I feel like I'm going on and on. But
no, I want you to. Please don't apologize.
Like, as your children age, there's new worries. Is Will going to be able to ever get a driver's license? I'm kind of hoping that the self-driving cars become affordable by the time he's up there, because I don't know that he'll be able to pass that test, or have a good, quick reaction that you need when you're driving. Will he be able to have a decent job besides just cleaning tables at a restaurant? Like, I don't know these answers, and I worry about things that I can't control. And then I think, oh, well, I need to make $1 bazillion so that he can be taken care of. So then I work harder, and, you have to take a step back sometimes and just be like, I can't control it. I have to take each day and deal with what's in front of me right then and there. And, your children will surprise you. It's funny, the things that you find joy in that a normal developing child's parents probably wouldn't even notice. With all this pandemic stuff, I've been working at home more, and I go on Zoom calls and I'll tell my kids, do not come in this room. I'll threaten them. And, they always come in for some reason. There's always an emergency. But like, Will wrote a note that said, "Go outside, Will." And so that was the first note he's ever written me. And it, like, I don't know, your heart just swells because you're like, oh my God, he wrote me a note. He's communicating with me by writing it, and I know what he did was go over to Alexa and say, "Alexa, how do you spell go?" And she'd tell him, but he could write it down after that, And so something like that just excites a parent like me. At 14, it took him that long to write me a note, and of course I've kept it and put it in my keepsake box, and, I do things like that. But yeah, I think the whole process of when you're realizing your child is not normally developing, there's grief and frustration and anger and jealousy. I was jealous of parents that had all these super smart kids who were excelling at everything, and it was just easy for them. They can tell their child, go get your shoes on and get in the car, and it's done. Whereas it was such a process just to do that simple thing for us. So
just will understand the gravity of his situation, and also when he is communicating, even though it's coming out a certain way in his mind, is it making sense, or is the disconnect start all the way back there before the delivery system?
I definitely think it's making sense in his mind, because like when he's trying to tell a story, he can't get all the words out that he wants to say, but you can see him start to say it, and then he'll pause and he might go to a different word, kind of like how I know some of my patients do after they've had a stroke, because you can get apraxia after you've had a stroke because it affects a certain part of your brain. And so they may be trying to tell you something and they can't think of the word. So then they go to a similar word. It's called substitution. So, and I see him do that when he's trying to communicate. So I know his brain is going faster than his mouth can go, or even his language capabilities. Like I know he knows what he wants to say. But what's interesting is that he learned so much language from watching cartoons and TV shows, and he picks up on that language and he says things that it sounds really scripted sometimes, like it's from a TV show that the tweeners watch or whatever. So I see that he learns through repetition of watching things like that from normal conversation. And so he knows he has autism. I don't think he quite understands apraxia right now. And we've had to explain it to him in ways that he can understand. So we'll say like, sometimes your brain feels a little mixed up in what you're trying to say. It might be hard to get it out. And so he'll use that explanation, but he's now starting to understand how to manipulate us with that information. So if he wants something, he's like, "Oh, Mom, it's my autism," is what he calls it. And we'll say, "No, it's not your autism. You just don't want to do your homework," So he realizes it's harder for him to learn, but he goes to a special private school now where all the kids are 1 to 2 grade levels behind. They all have trouble learning. Most of them have dyslexia. Oh, he has that too. Forgot about that one. Yeah, just add it to the list. But he knows that at that school, he doesn't feel any different than any of the other kids because he's not getting pulled out. They all work hard at learning letters and writing and math and science, and they're allowed to communicate the way that's easiest for them. So he uses a lot of gestures because he can't, and a lot of facial expression. But a lot can be understood that way. Absolutely. I mean,
there's improv. Yeah, absolutely. In improv class, there's a game called Babel, and you have to do the whole scene talking gibberish and try to convey what the scene is about. And every time I've ever experienced that, whether watching it or doing it myself, everybody gets it.
Right. Well, and that's what years 2 and 3 are of a child with apraxia, because they can't talk. So they do gibberish, but they go, mama, 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 and like they'll do the hand gestures. And that means I want my juice, And so there's like for a long time, that's how I described his speech and language was it sounds like gibberish with intonation. Like it's just, he's got the pragmatic language down. He just doesn't have the semantic language down. So it's very different. Yeah.
Is dyslexia apraxia adjacent?
I think there are a lot of children that definitely have both. Another thing that I didn't mention that he has is called central auditory processing disorder. And so when you have a lot of different auditory inputs coming in, it can affect how you can localize what you're listening to. So think about like a classroom of 20 kindergarten kids, all in their chairs, scooting around. Half of them probably have ADHD, playing with their pencils, papers rustling, teacher talking, someone mowing the yard outside the classroom. Like, there's so much auditory input coming in, and they just can't focus on just what the teacher's saying. That's kind of an example of central auditory processing. So you can they look like hearing aids, it's called an FM system, or you can put those on their ears, and then the teacher wears a mic. And then that sound of the teacher talking is the loudest input coming into their ears, and it blocks out all the other sounds. And the difference in what they can learn and focus on is amazing. So, and that's another one of those disorders that it's really hard to diagnose that before around 8 years old, I think. But the audiologists are getting better and better at doing certain things to kind of work on that. But yeah, I think all that kind of goes together: the dyslexia, the apraxia, the central auditory processing, and so pretty much Will's just under a developmental delay umbrella because he has so many different things that are challenging for him.
I think you're right, though. The fact that you went into this career choice certainly paved the way for you to have a better understanding and empathy.
Yeah, I do. And sometimes, it's funny because sometimes when I have a mom or even a caretaker, like for some of my adult cancer patients, their child is bringing them, and maybe their parent is a difficult person. Because if you think about most head and neck cancer patients, most of them have been drinkers, smokers their whole life, right? So family dynamics are hard for a lot of those patients. But sometimes because of the side that I've been on, I will take the caretaker aside and I'll say, hey, you're doing a really good job here. You need to know that. You need to know that I see what you're doing behind the scenes. I see how hard this is. I know the grief that you have, and I know how hard you're advocating for your child. And you need to hear that you're doing a great job, because those moms and dads and, caretakers, they don't hear that. You don't hear that from your doctor. You don't hear it from the teachers at the IEP meeting. The few people you may hear it from would be your own family, but nobody tells you that. And it's like this whole identity that you have, and you always feel like, am I good enough? Am I fighting hard enough? Am I reading enough? Am I paying enough money to go, $2,000 to Vanderbilt's education evaluation that insurance doesn't cover? Like, am I doing everything I can do? Did I move to Mississippi to go to the Magnolia Speech School and pick up my whole life just for this, to see if it would help my child? Like, am I doing enough? And sometimes just to have that person tell you, you're doing awesome. Your child is thriving because of you.
You put the human, that's the thing, is I think so many parents feel alone.
There's a lot of that. I feel that way sometimes. And I know more about it than probably 99% of parents that have a child with apraxia. I have sat on my sofa and cried. He's
a good boy. I've spent time around Will. He's a sweet kid.
Yes, he's so compassionate.
Yeah, and he tries really hard. And my friend, whose son also has apraxia, he is such a love bug. It's sort of, it's almost like where there are deficits in this one area, they get compensated toward this other area.
Oh, for sure.
Like kids with Down syndrome.
He's so drawn to babies. There have been two instances that I can think of, where one is when he was at his after-school care. They said, well, Will kind of got in trouble today. And I'm like, what? He doesn't He doesn't do anything terrible. Now, if it was Luke, absolutely. I know Luke would do something to get in trouble. That's my younger child. But when they said, oh, he called someone a butt face or a butthead or something stupid that kids would do. And I was like, Will doesn't even know that word. Like, he's never even said that word around me or my husband. Like, I was like, he doesn't even know how to be mean. He couldn't, I don't know. It's like he couldn't think, oh, I'm going to make that person mad by calling them a name. He doesn't understand that. Whereas that's like just an innate skill that Luke has, right? Will doesn't know how to be manipulative, really. But that's what I'm noticing he's starting to do now. He's getting a little bit better at that when it comes to getting out of things. But when he was that age, he really didn't know how to do that. They also said he pushed some girl this happened in kindergarten. He pushed some girl that was in line behind him and he got in trouble for that. And I was like, Will is not aggressive. Like, he's never done that. And when I did bath time that night with him, he had all these scratches across the back of his neck. So like a child had scratched his neck when they were in line behind him, right? So he was just reacting to getting hurt. But because he couldn't say, but she scratched me, I'm just reacting like, so yeah, there's not a mean bone in his body. But Luke, on the other hand, where did I go wrong? No, I love him.
How is Will with music? Because I know, again, and I'm just comparing because I don't have a lot of data on this, but
with music,
because for Luke is the name of her son.
Okay.
Yeah, and he absolutely goes ballistic happy for classical music, and in fact, from a very young age, he couldn't talk yet or anything like that. He would conduct like a conductor.
Really?
Yeah, to the music, which is, I think, an autistic music tends to really light up an autism brain, I think.
So, I don't know, because Will, early on, I love to sing, even though I'm not a singer. And I would always sing to my kids. Will would always put his hands over his ears and tell me to stop. I know I'm not that bad. All right. So but I think his was more of, he never wanted me to play music loud. He's always been around music. Like, it's always been a part of our life and our family, but he, growing up, I could never turn it up in the car. But I think that was more of the loudness more than the music itself. But he's never really been drawn to any specific kind of music. His kind of fascinations are with, like cartoon type things. Like, we were very into Thomas the Train for a while. Then it was Toy Story. He dressed as Woody for a good 3 years, probably. But he just, as long as he had his hat and his vest, he was fine. He could do whatever he wanted,
I love that he learned language by watching television. It reminds me of that scene in Splash when Daryl Hannah as the mermaid is learning how to talk by watching television. And
very much like that.
Yeah.
Yeah, it's very much like that. He even does gestures like that. So if he's like going to tell you something that he wants to tell you, but he knows that it's kind of one of those things that you do it to the side. Like, he'll even put his hand up and be like, by the way, and he does this whole gesture thing because he sees that on TV. But, that's how he learns language. So it's interesting. Music is not... Now the shows he watches, they play a lot of music in the background. He likes like the anime, so like Yu-Gi-Oh and Pokemon and all that kind of stuff. And they always have like hard rock music. So I'll catch him dancing around in his room to that sometimes. But
I love that. That's great. It's a little metalhead.
That's right.
How has it been for you in a relationship? Because you're married, and a lot of, I think, families that have children that have these issues, it puts quite the strain on the parents. What is some
Definitely.
advice you can give to help people who are maybe going through some stuff to stay connected to their partner?
Well, I think just with any relationship, communication. I mean, that's such a basic answer, but, um, you know, 87% of marriages of special needs children don't last. It's a really high number of divorces. And I think it's because when you have a child that is really sick or really struggling, you focus so much on the child because they're your world that you forget to focus on each other and support each other. And you're both scared and you're both fearful and you're both angry and you're both grieving. Um, and that I think unless you, and I know I struggled in the beginning years of my marriage. I mean, marriage is hard on its own in the beginning, learning to live with someone else. But then you throw your first child having all these problems in there, and the financial burden of a child with special needs is incredible. It makes it hard. But I guess my advice would be to communicate and to talk to each other and to go to the evaluations and the IEPs together. That's something that we didn't do very often. Sometimes we did. But, when both parents are working, that's hard because there are a lot of appointments. There are a lot of evaluations. And, with me being the speech and language specialist, he would just defer to me a lot about the avocation and all the different things that we need to do for Will, which is okay. I mean, I feel better for that. But then there are times where I'll freak out because I'm like, I know everything. He knows nothing. What if something happens to me? Then what's going to happen with Will? I remember talking to some of my friends that are speech therapists. I'm like, if anything ever happens to me, you're going to have to help Jace. You're going to have to teach him what to do and how to advocate at an IEP meeting, go with him and, make these things happen because I do all of that just because part of me is a control freak. And also because I know more about it. And so I feel like I can talk the talk when I'm sitting in the IEP meeting or whatever in front of the doctor. So I think that it's hard, a lot of marriages won't make it, but to at least learn to co-parent, even if that happens for the sake of your child is still important. And, not everybody's meant to be together forever, but you have to be the adults and you have to work together to make sure that your relationship is not making the whole situation worse. So, it's hard. And I've had this discussion with people that I know that have children with special needs. I'm like, y'all go on a date night. It's hard. You got to get a babysitter, but, the relationship does suffer, at least in the beginning, because you're so focused on the child.
Yeah. I mean, that makes sense. And I think that's good advice. Let's shift gears now. I want to talk about something that is the craze of the nation. About 10 or 15 years ago, it seems, people started talking like this and like a lot. Can we talk about that and how that came to be and what you feel about that? It's called vocal fry, right?
Yeah, I think I was like glottal fry, vocal fry. Yeah, it's sort of the bane of my existence as a voice therapist. I hate it. So it's talking in the bottom of your pitch range. Most people don't realize that you have about 3 octaves of pitches from your lowest to your highest. But if you talk in the very bottom of your range and you're kind of tightening the muscles in your throat and holding back airflow, all it sounds like is gruffness. So it's called glottal fry. So a lot of times when I'm listening to NPR or something, or podcasts like this one, I get a little bit irritated by the voice on the other side if they talk down here like this the whole time.
Yeah.
This is like glottal fry. So if you're not sure what I'm talking about, just watch an episode of the Kardashians. They are infamous for talking like this. And it's just not pleasant to my voice therapy ears.
Will it do damage over time as well? Does that kind of talking?
I wouldn't say you damage it. I think that most people are like, well, where should I be talking? Like when I point that out to them, and I'm like, well, usually it's where you say, mm-hmm. So when you go, mm-hmm, that's about 5 to 7 notes up from your bottom of your pitch range. That's what we would call your modal pitch or your appropriate pitch. And sometimes I do therapy to teach people, number one, to recognize where that is. But if I'm going, that was about 7 notes from my bottom. I couldn't go much lower. That's sort of the pitch range that I should learn to talk around. And it doesn't sound glottal fry-y because it's not in the bottom of my pitch range. And I'm taking a breath when I say something. I've got the airflow behind it to support it. And what singers especially don't realize is if you talk like that a lot in the bottom of your pitch range, you're building up tension all day long. Because even a professional singer with a multi-million-dollar contract and label, they only sing about 5% of their day. But they'll talk 95% of their day. And if they're talking in the bottom of their pitch range and they're not using good airflow, another one that comes to mind is Miley Cyrus. Her voice, I feel sorry for her speaking voice, but I know she's working on it. I heard a podcast where she was working on it, so good for her. I
love the way she sings, though. She's a badass.
Yeah,
I'm a big fan.
Can really belt it out. She's definitely got talent,
Mm-hmm.
So, but the speaking voice you can build up tension all day long. And then you want to go and do a show or a recording and you've built up all this tension. And now you have to kind of work through that to try to get your singing voice to be at its maximum because you want it to be the best it can be. So it can have an effect. Your speaking voice can affect your singing voice. And it can also make you feel like you sound bad, if you are a podcaster, like so many are these days, or if you are on the radio or, just have to be a speaker for a living. I mean, I work in the medical field. I work at an academic medical institution. So many of us have to give lectures and presentations. And I mean, what better way to zone out from what someone's telling you than if they say, talk like this the whole time and it's not easy to listen to. And then they do the fillers the whole time like this, So as a voice therapist, I give a lot of presentations. I've even given a presentation on how to give a presentation.
How meta.
Because the voice part of it is it tells a message. I mean, I know you know this from your line of work as a podcaster. If someone is really monotone the whole time, it's hard to sound interested. And, even doing simple exercises like a lip bubble. If you sit there and you did 15 lip bubbles before you recorded your podcast, you would find that you had a lot more inflection of your voice as you're talking. So it sounds more interesting.
You bring up a really good point. I should start doing vocal exercises before these interviews. I haven't been, and it's a good idea. I heard that Celine Dion doesn't even speak for a couple days before she sings.
So that's one extreme.
Yeah. Although I do have a pin that you gave me way back when that says, I am on vocal rest and cannot speak. I still have that
Must
pin.
be yes, no questions only. Yeah.
Yeah.
Yeah. So we used to give that to people after surgery because they would, you have to rest your vocal cords after you've had vocal cord surgery.
Right.
There's a
I have that weird birth defect. So I was having a lot with my touring schedule. I was having with singing. I was having so much issue.
There's a recovery process. So, sometimes that's the hardest thing. I tell people, I go, yeah, we're going to give you some medicine. You're going to have to take your reflux medicine every morning. You can't work out, no coffee, no throat clearing, drink lots of water, blah, blah, blah. But the hardest thing that you're going to have to do is to be quiet. It is the hardest thing. And anyone who's ever lost their voice for a day or two, it's really hard to not try to talk or whisper or anything. So, it's crazy how hard it is to just be quiet for a few days.
And whispering is really hard on the voice.
If you whisper in a strained whisper, yes, it is, because you're kind of tightening everything and then trying to force air at the same time too. So yeah, we tell people to avoid the really hard whisper, like, hey, how are you? But if you just do some kind of mouthing whisper, I guess it would be better than nothing.
Sex pot whispering is okay. And also that low tone in a hypnotherapist is also very good. That monotone, it'll drift you off. You, because of your position and being in a hospital and working with patients and their mouths and throats and airways and things, you must have to gear up pretty extensively because of COVID.
Oh, absolutely. Yeah. My whole field has changed immeasurably since last February, and it's been crazy. And I just got my vaccine yesterday.
Woo! Congratulations.
I feel so grateful to all those people who worked so hard on the vaccine and all the scientists and everything. I mean, I felt guilty in a way of getting it, but I know there's so many people like my parents that I would rather have given it to, but I also work with some of the most fragile patients who, if they get COVID from me, it will kill them. Like all my tracheostomy patients, we change trachs. I scope them for their airway issues. My head and neck cancer patients, I change out the little prosthesis in their neck, and they're coughing blood and mucus on me on a daily basis. So I'm at super high risk. I'm what you would be considered the tier 1 frontline healthcare worker.
Thank you, by the way.
Well, my pleasure. I love what I do. It was really hard because we shut down for about 2 to 3 weeks where we could not see our patients while we were trying to get PPE and figure out what was going on and how could we do what we do safely. And so like now, if I'm going to scope someone or change a trach or help their voice after they've just had their throat removed from cancer, I have to wear a gown. I wear an N95. I wear another mask over that. I wear headgear, gloves, obviously. And there's a whole donning and doffing procedure. So, I can't see as many patients in a day as I used to be able to. And, you lose a little bit of the human side because you can't see their face or, they can't see your face. Or I used to always give my patients hugs after, when I was saying goodbye to them, and I'm just a hugger, and I can't do that anymore. And I hate it. I hope it'll be back soon, but I've got to get another vaccine in about 3 weeks, to really be effective.
Have you noticed anything awry or
side effect or anything? I did have a headache last night on my way home from work. So I got the vaccine around 2:00. The headache started around 5:30. I took some ibuprofen before I went to bed and I was fine. Like my arm hurts just like I got a flu shot or whatever. But that's the only thing I felt today. Like I feel perfectly normal today. So I hope that little mRNA is in there working and forming the proteins and getting my fight response jump started in my body.
Now, I know there'll be people listening to this episode who will say, wait a minute, she got a vaccine, but she has an autistic child. The people that think that there is a link. Do you want to talk about that real quick?
Like the anti-vaxxers. Yeah, it's definitely a controversial topic when it comes to autism. I know that we did genetic testing. There's a lot of genetic testing with autistic children now. Will actually has a genetic duplication on a chromosome. Like, I feel like his developmental challenges are from that, because myself nor my husband have it. They can't exactly say how that ties in because it's kind of a novel duplication on the chromosome. I had him look at it again just like a year ago, and there's still not as much interpretation information as we would hope for. But I don't believe his vaccines cause that, because I noticed things early on that he did strange with his mouth and things. So, I wasn't afraid of this vaccine. No, there are some people, it hasn't been able to be tested on children or pregnant people. So I understand people that have hesitation in getting it. That I do have a very good friend that was a couple months pregnant when she actually got COVID and has since had her baby. And, baby's great, fine right now. And I have some friends that are recently pregnant that just got COVID. And they will not be getting the vaccine. But, like a lot of other vaccines, it's hard to test on special populations like that, especially early on when you're trying to do expedited something like this. Now,
absolutely, it takes years for research to come through.
And funding. I mean, that was why this was so expedited, was because there were the top companies, there was unlimited funding to get us an answer. And everybody was working together. It wasn't like a big money-making scheme. It was, how can we save the hundreds of thousands of people that are dying from this and all over the world? And so I feel like it was almost kind of how it reminds me of how our country kind of pulled together after 9/11, where everyone was helping each other and looking out for the good of each other. Like, that was such a horrible time in our history and life-changing for me. But it also was a time of healing and togetherness that we have lost as a nation.
I'm looking forward to the healing coming back.
Me too. I am too.
Fear makes people do very strange things, and before many people can acknowledge fear, they choose hate, because that's a much easier emotion to access.
Yeah, and I think our information outlets or disinformation outlets.
I mean, it's been a shit show.
Are crazy. It's crazy right now. It's crazy.
And I am excited to get a vaccine. I cannot wait.
There is a sense of relief that you're not gonna hurt your patients or your parents, your children or your friends. That's my concern all along, is that I'm going to hurt someone, and not intentionally, but, there's outbreaks right now in my office. We've had 5 people get it in the last 2 weeks, and I've shared an office with one of those people. Like, I was nervous about it. So there is a sense of relief and a sense of gratefulness to all the people who do what they do every day on the front lines. It's sad. The COVID wards at our hospital, we're out of ICU beds. Mississippi we were a little late in the game. Like, we were better off than the New Yorks and
understandably,
places like that. We're very rural.
Major mecca. Yeah, of course.
We're very rural. So we're not on top of each other. We don't use mass transportation to get around every day. And, so we were lucky that we got to learn from them. Like, I remember being on a Zoom call with a doctor at Mount Sinai in New York who was teaching us about COVID. So we had that benefit going into it that other people didn't. But right now we are struggling because we have such a high African American population in Mississippi that we have higher death rates. So that's sad,
Yeah, it's really overtaking people of color. It's overtaking the indigenous tribes, and we need to get a grip on this for sure.
And I don't feel like if you don't want to get one, if you don't want the vaccine because you want there to be more data, more research, I just think you just need to read about it, because not everything about this vaccine was brand new. I mean, they built it off of the SARS vaccine.
Right.
And so there's two different there's vector vaccines that are coming out from two other companies that are in phase 3 right now. So there will be options, down the road.
Sure. And I get it. I get people are nervous and that and all that, but all I can say to that is educate yourself, as you just stated. Read everything you can from reputable science sources.
Right. And that is not Facebook.
Not from Facebook, not from some weird video you saw that your aunt's sister's hairdresser sent you, but really, really spend time and research it like you would with anything, know?
Absolutely.
Yeah. Well, I'm glad that you got the shot, the vaccine. And I'm excited for myself included to get that.
Yeah.
LA is getting hit pretty hard. Nashville is now number 1 in the country for cases. So it's bonkers. And of course, Ellen had COVID. That scared the shit out of me.
She was pretty sick. I mean, she looked like she had a bad flu, and she had negative tests before that.
That's right. She had 2, right? 1 or 2 negative tests and then positive.
Yeah.
I mean, and that's the thing, is that when it takes time for antibodies to multiply enough for you to get sick, and depending on your immune system, somebody like me, I have an autoimmune disorder, right? Not only am I Marfan, but I'm also celiac. So who knows? We know where that puts.
And you'll need to talk to your doctor about getting the vaccine, like if that's right for you.
Oh, because of the autoimmune celiac?
Yeah.
That's a good point.
Yeah.
I can't get all the awesome facial fillers that women get to get as they age.
I don't know if I would call those awesome. I've seen a lot of those people. So
some people go out of control, but at the same time, I'm like, oh man, I don't even get to do that stuff because
I think you're beautiful the way you are.
I love you too.
Yeah.
Josie, how can people get a hold of you if they have questions, if they want to know more information?
They can either email me. My email is jalston, ALSTON @umc.edu. Or they can call me if they want. My work phone number is 601-984-6591. And I don't have the answers, for everything, but I am always happy to share my experiences or give advice, and you don't have to follow it. But, I love talking to other parents of special needs kids, because we have to be each other's support sometimes,
What are some things? There are definitely going to be somebody listening who is starting to notice some differences in their child. What are some things to look for that might present as a bit of a red flag to really focus in on, so that they're prepared in case it is something?
So like if they don't like getting their hands dirty, if they won't put their hands in their food and play around with it, they don't want to touch their Cheerios, things like that. If they have groping things with their lips, like if you say, give mommy a kiss, and they can't really make a kiss with their lips. If their errors in their early language are all over the place, like sometimes they say tut-tate for cupcake, and then the next time they say pup-ache, and the next time they say mup-ache, if they're having errors that are not consistent, sometimes that's a sign of apraxia of speech. And, if they have trouble doing normal motor movements that other kids are doing, holding their bottle. Will used to splay his hands out when he would hold his bottle or rub his mouth on my collar, getting like sensory input, which I always thought was kind of strange. Looking back on it, I can sort of see the early signs. And don't be afraid to advocate for your children. I mean, I had to make my pediatrician give me a referral for the early evaluation process through the state of Tennessee. He told me I was a overreactive speech therapy mom. But I said, well, I don't care. I still want it. I still want you to do it, and I pushed him. And you got to be pushy.
Did he apologize after the fact? I am always curious about doctors who think they know everything.
Nope. No, he was a good doctor. I liked him, but I just feel like pediatricians see so much of everything and there are some overreactive parents. I'm not saying every parent shouldn't push, but it's your prerogative. You can push them. And sometimes the first answer, there's good speech pathologists, bad speech pathologists, good doctors, bad doctors. Like sometimes you always get a second opinion. Like I tell my patients that all the time now that come to see me for their first opinion. I'm like, I'll be happy to give you some second opinion people. Like, don't be afraid.
Yeah. Advocating for yourself and for your family is key. Mm-hmm. With insurance companies as well. I've gone toe to toe with insurance before.
Yep.
Yeah. The trick with that is always CC the insurance commissioner. It's amazing how quickly things turn around in your favor.
Things can turn around. Yes, that's great advice, Susan.
It's
I love that advice.
Yeah, it makes a huge difference.
And most states have a free legal advocate that you can take to like an IEP meeting with you. That also makes them listen to you a little bit more if you need help.
Yeah, man. We have some broken systems. I hope as we move into the future that those issues get fixed because it's not like we're making less people.
No, we're
and
not.
The more people means statistically, the more things.
And we really need to figure out a way as a society to help these people as they age. Because you get some help in the schools, but once you're 18, it's a real struggle as to some of the help that you need with employment and insurance and all kinds of things. So
and in some cases they lose their benefits if they get even the most menial job.
Right.
So it's not like they can afford to support themselves on a $7 an hour job, but at the same time all their care is taken away because they have a job. So it's a real double-edged sword.
Yeah. I know.
Yeah. Josie, I love you.
I love you too.
Amazing at your strength and
that's so sweet.
everything. Yeah. And thank you for everything that you do. You've helped me on many occasions. And thank you for being a part of this and for being on Hey Human.
Well, it's my pleasure. And thank you for getting these important messages out there that you do so often and do so well. So
thank you.
I'm very proud of you.
Thank you, love. Thanks for listening, everybody. Bye. Rate and review Hey Human on iTunes or wherever you get your podcasts. Thanks. Bye.